Hi, welcome to the Family Voices of California Brown Bag Lunch Training Series. This is a statewide training series on health and policy topics affecting children and youth with special health care needs. Just to give you a little background about Family Voices of California, we are a statewide collaborative of locally based parent-run centers working to ensure quality health care for children and youth with special health care needs. We are the state affiliate of National Family Voices and California's federally funded Family-to-Family Health Information Center, providing statewide support to families of children and youth with special health care needs. For more information, you can visit our website. I wanted to give you a few notes today about using the software before I hand it over to our presenter. There are a few ways to interact today in terms of asking questions and listening. If you have a headset and a microphone, you're going to be able to speak up, ask questions through your computers by raising your hand. If you don't have a headset, that's okay. You can use your speakers to listen, or you can use your telephone and type in your questions, either one. If you want to find the telephone number, you just go to the audio mode, select use telephone, it's right there. Please enter the audio pin if you're doing it that way. You can also get it from your confirmation email. And just remember, if you're listening with your computer speakers and you don't have a headset, then you'll need to type in your questions. You won't be able to raise your hand. And if you have any problems, GoToWebinar is really good at helping you get online. So you can call them through their website or send me a chat or a question. Everyone starts out on mute because with a lot of people there's a lot of feedback. So one more time, how do you ask questions when it's time for questions? Either you can use your voice if you have your headset or your telephone. Select this little hand icon. It's a little small column to the left of the menu for the webinar. If you click it, we know you want to be unmuted and you have a comment or a question. Otherwise, you can type in your questions using the question pane. Our one question we always get is, will we get the materials for today's webinar? Yes, we archive all webinars on our website. We'll send you an email in the next day or two telling you when we've done that. You'll be able to watch a little video of the presentation so you can forward it to other people. We'll send you all the materials. Today's webinar's got a lot of materials, so we'll send you the link for all of that and you can download them at your pleasure. I wanted to give one plug before we go, which is Family Voice of California does an annual statewide health summit and legislative day for families and professionals. It's coming up on March 1st and 2nd. Registration is open, so please sign up. Encourage families to sign up. We learn a lot about the pressing policies that are coming this year for children and youth with special health care needs and give you an opportunity to interface directly with your legislators around those issues, and we give you lots of help to do that. And so if you just visit our website, you can register for the conference and see all the cool speakers we've got this year. So with that, I wanted to introduce today's topic, which is healthcare reform, what it means for children and youth with special healthcare needs, with Janice Gurney. And Janice is the Public Policy Co-Director for Family Voices National. As I mentioned before, we're the state affiliate of Family Voices, but there's a Family Voices chapter or affiliate in just about every state now. And Janice helps direct our national efforts, which is very cool to have her today. So Janice, let me switch over to you as the presenter. One moment, guys. Okay.
Okay.
So just sit okay, and we should be able to.
Now let me make sure I'm right.
There we go, yeah.
Here. Okay.
Perfect, yep, see it.
Now, I need to minimize this. I see. Sorry, everybody. I'm just not accustomed to this webinar format. Okay, should I start?
Yes, please. Thank you. I was
okay.
muted. Sorry. Yes.
Hello. I'm happy to be here today. I want to mention that I'm based in Washington, D.C. and have a colleague, Brooke Lehman, who is the other co-director for public policy for Family Voices. And we work together to try to represent the interests of children and youth with special health care needs in Washington. There. What I was going to talk about today was just to give you a general overview of healthcare reform, as I'm not sure how much you all know about it. I'll sort of start at the beginning, and then I'll go through the provisions of special interest to children and youth with special health care needs and their families, talk about a little bit about the future of healthcare reform, and how you can get involved at a federal and state level. And then I'll go through some of the resources that you can draw upon if you need more information later. The healthcare reform law is really two laws, and I won't bother reading their long names, but for convenience, everybody now just refers to them collectively as the Affordable Care Act, or ACA. The basic structure of the law is to continue with the country's general format of having employer-based health care for people who, for most people who are employed, and then it also continues the state children's health insurance program until 2019. This was something that child advocates fought for when the law was being developed, because we wanted to make sure that children wouldn't be left without, left to have to join a new program, which I'll talk about in a second, getting insurance through the exchanges. We wanted to make sure that they would have a program that was good for children during the transition period to the new kinds of insurance available through healthcare reform. The ACA also expands Medicaid to 133% of the federal poverty level as of 2014. And that's optional now for states. They can implement that now if they'd like to, although very few states would have the money to do so. And the ACA also establishes a patient's Bill of Rights, which are insurance reforms that I'll talk a lot more about later. The other major thing about healthcare reform law is that it creates state-based exchanges through which uninsured people can purchase health insurance that will have to meet certain standards, which we'll talk about in a little while. And these, again, are for people who do not have employer-sponsored health insurance or cannot afford their employer-sponsored health insurance, and that's pursuant to certain standards set in the law. To purchase insurance through the healthcare exchanges or exchange in your state, certain people will be able to get subsidies called affordability credits, and they'll be provided for people whose family income is up to 400% of the federal poverty level, which is about $73,000 for a family of 3. The exchange will make it easier for people to purchase individual coverage because it will require that all information about the plans be presented in a comparable format so that you can compare policies easily, and the exchange should enable people to get individual health care insurance at a cheaper rate than they can now, because there'll be a lot of bargaining power since everybody will be buying insurance through the exchange. Many, or if not most, of the provisions of the ACA go into effect in 2014, but there are some that went into effect on September 23rd, 2010, and or other dates like July 1st, 2010. And so I'm going to be focusing on those because they happen to be the ones that are of most interest to children with special health care needs. I'll just go through these very quickly because I'm going to touch on them again later. But some of the immediate provisions going into effect are the creation of a high-risk health insurance pools, one in every state, prohibition on lifetime caps and rescinding coverage, restrictions on annual caps, elimination of the pre-existing condition exclusions for children under age 19, coverage of adult children until they reach age 26, coverage of preventive health services at no charge for certain insurers, and strengthening community health centers. Also, the law reestablishes funding for family-to-family health information centers. As Tara said, the Family Voices of California functions as the state's family-to-family health information center, which is so it receives federal grant to help families with children with special health care needs to navigate the health care system. And funding for these programs was going to run out, but we were able to get funding for 3 more years through the health care reform law. The law also creates a historically high level of federal funding for prevention and public health. It establishes maternal, infant, and early childhood home visiting programs. It requires the federal government to have a website with information about how to get insurance coverage for your family, and that's in effect right now. And it requires a maintenance of effort in Medicaid and CHIP. About that maintenance of effort, it's something that's quite controversial right now because governors from 33 states have signed a letter to Congress asking that the provision be repealed. As you know very well, I'm sure the states are in terrible fiscal situations, and they feel that they can't go on without cutting Medicaid. And this maintenance of effort provision in the law requires them to maintain current eligibility standards, methodologies, and procedures until 2014 when they have to expand Medicaid anyway. And so they can't, what this means is that they can't cut people off the Medicaid rolls right now. And they can, however, make cuts in reimbursements to providers or cut services, cut out certain services or limit the scope of certain services, but they can't kick anybody off the rolls, and they would like to be able to do that. So there's going to be a hearing next week in Congress and the House to talk about this, and we'll see what happens. It's one of the somewhat vulnerable provisions in health care reform. In 2014, there are a number of provisions that go into effect, and again, I'll just run through these quickly, although I'm not going to talk about them later for the most part. State health insurance exchanges, health homes and Medicaid. There's money to promote health homes or medical homes and Medicaid. There's also funding to support home and community-based services, grants for navigators, meaning entities like family-to-family health care information centers that can help families navigate the healthcare system. There will be Medicaid as of 2014 for former foster children up to age 26, and again this Medicaid expansion to 133% of the federal poverty level. That is also historically unprecedented. The Medicaid program for a long time was tied to receipt of welfare and or having a child. So if you were a pregnant woman or in some cases a parent, you could get Medicaid, but if you were a childless adult, it was very difficult. And that has now changed so that as of 2014, if you have income below 133% of the federal poverty level, or about $14,000 for an individual, you can be eligible for Medicaid. And in California, it's estimated that this will mean 2 million more people will be eligible for Medi-Cal. And that's only legal residents that can be eligible. Does anybody have any questions so far about the basics of healthcare reform?
Okay, so if anybody has any questions, go ahead and do the raise your hand function, and we can get you unmuted to ask your question. Or you can go ahead and type in question right now too. Just give folks a minute. Okay, I'm not seeing any right now, Jenna, so why don't we keep going? And if people have questions, they can go ahead and type them in.
Okay. Now I'll talk some about the provisions of special importance to children and youth with special health care needs. One of the biggies is the elimination of the pre-existing condition exclusions for children under age 19. Of course, this is very important to children with special health care needs. They, by definition, have some sort of pre-existing condition and historically have been denied health insurance as a result. So effective for plan years beginning on or after last September, they can no longer be denied insurance for having a pre-existing condition, and they can no longer be denied coverage for services relating to that condition. This does not apply to certain healthcare plans, those known as grandfathered plans on the individual market, meaning if you have an individual plan that was in effect when the law was passed on March 23, 2010, then this protection does not apply. Unfortunately, there's no control on premiums, so insurers are free to impose high premiums for coverage. Another implication of the ban on the pre-existing condition exclusions was that some insurers decided they would no longer offer child-only plans for purchase. Current plans were not going to be affected. And the Department of Health and Human Services responded, first of all, by trying to pressure the insurance companies to reverse their decision not to provide child-only plans. And they also told insurers that they can limit enrollment to certain open enrollment periods if permitted under state law and take other measures to counter the potential for adverse selection. The insurers were worried that families would choose not to buy insurance for their children until their children got sick, and then there wouldn't be a broad enough pool for them to be able to pay out insurance for the children who needed the coverage. Another feature of the ACA is that it prohibits rescissions of health insurance, and this is often described as prohibiting rescissions when somebody gets sick, which is something that insurance companies did on occasion. When somebody got very sick and they started to be very expensive, the insurance company would look back at their application and try to find some reason to nullify the policy. So that is no longer allowed unless there is intentional fraud or misrepresentation of material facts in the application. Another thing that's very important to children with special health care needs is the restrictions on lifetime and annual dollar limits. Certain health care plans imposed lifetime dollar limits on what they would cover. So, for example, they would say, we'll cover up to $1 million worth of, we'll pay out up to $1 million, and after that, you're on your own. We're not going to cover anything, which, would affect certain children, even newborns who have very, very expensive care if they were premature, for example. So now that's not allowed any longer. And until 2014, when they were prohibited altogether, there are restrictions on annual dollar limits. They can't be set below certain thresholds, which are set out here on the slides. Unfortunately, insurers can still place limits on the number of visits per year or impose other limitations on the scope of services or drop coverage for certain services that are not required under law. So it doesn't mean that you can get all the services you could possibly want, say for speech therapy or occupational therapy. They can still limit the number of visits, but they can't say we're only going to pay out $1 million over the lifetime of this policy or a certain amount per year. High-risk pools. The ACA required states to establish high-risk pools by July 1st of 2010, and if the state didn't want to do so, the federal government would establish the high-risk pool, which they've done in about 20 or 23 states, I think. To be eligible for coverage under the high-risk pool, a person has to be a U.S. citizen or be lawfully residing in the U.S. They have to have lacked insurance for 6 months at least, and they have to have a pre-existing condition or have to have been denied insurance due to a pre-existing condition. And these pools will no longer be necessary after 2014 when pre-existing condition exclusions are not permitted. The California Pre-Existing Condition Insurance Plan, of course, has the same standards as the national, but they've elaborated. The information that I have here is from the website, and it elaborates a little bit on what it means to have a pre-existing condition. You can have been denied individual health insurance coverage within the past 12 months or have been offered individual health insurance coverage at premium rates higher than those under the current high-risk plan preferred provider organization. The California Pre-Existing Condition Insurance Plan covers prescription drugs and a range of other health benefits. Premiums are based on location in the state and subscriber age. So this monthly premium here is just an example of what it would cost a 50-year-old in San Francisco. There are annual deductibles varying on whether you're getting your services in-network or out-of-network, and there's coverage of prescription drugs with a deductible, and there are annual out-of-pocket maximums. And the website is here for people who want more information about that plan. Another very popular provision of the ACA is coverage for dependents until age 26. And I'm sure you've heard about this already, but parents can keep their children on their insurance plans until the child reaches the age of 26. And the child does not have to be a dependent for tax purposes. The child can be married, does not have to be living at home. Whoops. So it's a pretty generous benefit, and this went into effect in September. It does not apply to every single insurance plan. It does not apply to grandfathered group plans if the child has an offer of insurance coverage from an employer. So if the adult child has an offer of insurance coverage from a group plan that was in existence in September, this doesn't apply. Another good provision of the ACA is that it eliminates charges for preventive services. And again, this is not for all insurance plans. It does not apply to grandfathered group or individual plans, meaning those that were in effect in March that are group plans or individual plans or self-insured plans, I believe. So, but otherwise, the full range of preventive services is covered for children and without copayments, coinsurance, or deductibles. And actually, it's covered for adults too. The standards for prevention for children are pursuant to the Bright Futures recommendations for children that were developed by the American Academy of Pediatrics and the federal government. The essential benefits package, this has limited applicability also. Large group plans and grandfathered plans are exempt, and so are self-funded plans, which means that a majority of children with special health care needs are not going to be affected by this provision, but it may set a standard for other insurers, and that's the hope. And it is a good benefits package that will have to be met by all of the insurers who are supplying insurance through the exchanges. So if you're buying insurance through an exchange, you will be guaranteed certain benefits that are spelled out in the law, and I'll read a few of them. But it's important to note that the Department of Health and Human Services has to issue regulations detailing the things that are and are not considered part of these benefits. But as I said, in the law, these certain things are spelled out. There are a number of them, but the ones of most interest to children and youth with special health care needs, I would say, are the habilitation and rehabilitation services and devices, the mental health and substance abuse disorder services, including behavioral health treatment. And this, I know, was intended to cover applied behavioral analysis and other behavioral treatment therapies for autism and other conditions. Pediatric services, including oral and vision care, preventive and wellness services, and chronic disease management. And again, there are other essential benefits too, but those are ones of special interest. Another thing the ACA does is give more protection for appeals and reviews of insurance determinations, so that if you're denied coverage, you can appeal that within the insurance company and then have an external review by an impartial party. Pursuant to interim final regulations issued by HHS, the coverage would continue pending review, and a decision would be required within 24 hours for urgent care. The ACA also is promoting a no wrong door policy, meaning that if you go to apply for benefits through one avenue, such as Medicaid or CHIP, you will be, you won't have to be referred to another agency to get a different kind of benefit that maybe you're qualified for. For example, if you think you're eligible for CHIP, which I think is Healthy Families in California, then and you apply for that program, but it turns out you're eligible for Medicaid, you don't have to go to another agency and fill out a whole new application. You'll just, your application will just be transferred, and you'll be deemed eligible without having to go through additional bureaucratic hoops. And hopefully this is not something that most of you need to know about, but one other thing that the ACA did that was, this is relevant to children with special health care needs, is that it allows concurrent care for children who are receiving hospice services. Previously, if someone was getting hospice services under Medicaid, they had to forego curative care, but now they can get curative care and also benefit from the services of hospice, such as counseling and palliative care. Should I stop for questions right now, Tara? That was kind of a lot of stuff.
Sure. Why don't we go ahead and stop for questions? So go ahead and if you have a headset and a microphone, you can go ahead and use the raise your hand function. It's a little hand icon in the column. If you don't have a headset and microphone, you can type in your questions now. Okay, let's see. I have one question from Monica. Okay, Monica, I'm going to unmute you. Monica, are you there? Monica? I don't think we can hear you, so why don't you go ahead and type it in. Let's see, any other questions before we keep going? Okay, one question. Gwendolyn asks, is the hospice benefit just for children?
Yes, I believe that's the case. It's just for children.
Okay.
I mean, the benefit itself is, I think, for other people as well. I'm not really sure. But the availability of concurrent care is just for children.
Okay. Any other questions at this time before we keep going? Or you can either raise your hand or you can type them in. Okay. Why don't we keep going?
Okay. So I wanted to talk a little bit about the future of healthcare reform. I think this is on people's minds with all the news about the lawsuit in Florida where the judge ruled that the law is unconstitutional. That ruling came out of a lawsuit brought by 26 states claiming that the individual mandate, the mandate that everybody has to purchase insurance was unconstitutional because it was outside of Congress's power to do that. So there have been other cases like this as well in 2 courts, district courts, which is the lowest federal court. Judges ruled that the provision was constitutional, and in 2 courts they've ruled that it wasn't constitutional. So right now it's a tie. They're going to be, I think all of these cases will be appealed, and that means they'll go to the Court of Appeals, and then after that they're very likely to go to the Supreme Court. And it's really unclear what's going to happen in the Supreme Court. So we all have to wait and see. It could take a couple of years before this is resolved. Then the House of Representatives voted to repeal the health care reform law, but it's not, that legislation is not expected to advance through the Senate. As we speak, it's possible that a vote is taking place on this because Senator McConnell, who's the Republican leader in the Senate, was going to offer an amendment to an unrelated bill that would repeal the health care reform law. So it wasn't, the vote was not expected to succeed, or his amendment was not expected to succeed. And if it did, the President has claimed that he would veto any law that repealed the health care law. Still, those opponents of the law have other tricks up their sleeve. They can try to prohibit the government from spending any money to implement some of the components of the law. And this could end up in one of those showdowns where the government might close, because when the Congress is appropriating money for all the programs of the government, the opponents of health care reform could say they're not going to they're not going to vote for the measure if it doesn't include some provisions blocking implementation of health care reform. And so there could, be a case where we don't get an appropriations bill and the government shuts down for a little while until the game of chicken is resolved. And then in a couple of years, the health care reform law could be more vulnerable, because it's possible that the Senate as well as the House will be turned over to, or will turn over to a Republican majority, and it's also possible that we'll have a Republican president in a couple of years. So in that situation, it's possible that health care reform would be repealed. It'll be harder the longer it's in place, because people will start to realize the benefits of, say, elimination of pre-existing condition exclusions and coverage of kids up to age 26 on their parents' plans. So I think it'll be politically more difficult for repeal to take place. On the other hand, the opponents of health care reform could gain steam, and we'll just have to see what happens. Assuming that you support health care reform, what you might want to do is call Senator Feinstein, if you're from California, to urge her to not vote for repealing. I don't expect that she would vote for repealing health care reform, nor would Senator Boxer, but Senator Feinstein is up for re-election in 2 years, so she's going to be a little bit more sensitive to the pressures of any constituents who are urging repeal. So that, if you're for health care reform, it's good to counter that with letting your senators know that you're for it. And then also there are going to be these other votes in the House, probably on what I mentioned, efforts to curtail funding for health care reform implementation. So there may be cases where you're alerted to contact your representative. And speaking of alerts, I'm going to get to that in a few minutes. At the state level, there are lots of things that states have to do under healthcare reform, like establish the exchange, establish the high-risk pool, and they can take up certain options under Medicaid. So there are lots of opportunities for people to have an influence at the state level. One of the options that states can implement if they'd like to, starting this coming October 1st, is what's called the Community First Choice option, where, and this is one of the cases where there's more support for home and community-based services. It allows, under Medicaid, attendant services to be provided to somebody if they would otherwise have to be in a nursing home. So this is something that you might want to push in your state legislature, although of course California's fiscal situation being what it is, it seems unlikely that they would take this up. And then in general, I urge you to monitor healthcare reform implementation to see where you might be able to have an impact with your elected officials or insurance commissioner. And how do you do that? Well, you can join coalitions. Many organizations have action alerts at the federal level and state level, and I'll talk about those in a minute. You can submit comments on proposed regulations. You can get to know your state government officials, such as the insurance commissioner and legislators. I think this will be relatively difficult in California, but in a lot of smaller states, we work with advocates who are, on first name terms with their legislators. And you can educate your network, and in general, try to speak up and be heard. In terms of resources, these are some national ones. AMCHIP, the Association of Maternal and Child Health Programs, they have information on their website about children with special health care needs and health care reform. The Center for Children and Families at Georgetown University is a great source of information because they're focused just on children and families, and have very good, reliable information. And Community Catalyst is a national organization that issues regular updates on healthcare reform and occasional alerts. And then, of course, there's Family Voices. We don't have the resources that some of these other groups do, so we're not as we don't have quite as much on our website, but we do have weekly updates for members of Family Voices, and we'll issue alerts when necessary. Families USA is another organization that has great resources on its website for to teach you about healthcare reform, and also they have alerts that for taking action with Congress if necessary. And the Kaiser Family Foundation has a wealth of information about healthcare reform. Much of it is very detailed, but they have a great short video just explaining the basics of healthcare reform, and it's narrated by Cookie Roberts, and it's kind of cute. And it's, if any of you are trying to explain healthcare reform to people who are not at all familiar with it, it's a good resource. And then one of the Family Voices affiliates, the one in New Jersey, had a teleconference on the impact of healthcare reform in children with special needs, and that's available at this website given at the bottom of this page. And then in California, you're probably familiar with some of these, if not all of them, but there's healthcare.ca.gov, which is the California state government website. It has a lot of information on the status of healthcare reform implementation in California. The California Healthcare Foundation has a number of useful publications, and Health Access is a consumer organization that has a report on its website about the status of healthcare reform 9 months after enactment. And that website also has alerts that you can sign up for. And then at the top of this page is the statereform.org. That's a website of the National Academy of State Health Policy, which has a lot of resources on implementation of healthcare reform. So that is my presentation, and I guess I was talking really fast because we have a lot of time for questions and answers.
So we have some questions that have come in by typing. So please feel free to go ahead and type in any other questions you have now, or raise your hand, and then I'll start going through these. Monica asks, do children have to be dependents on your income tax reform to have health benefits?
No. If you're talking about the availability of your parents' health insurance until you're age 26, you do not have to be a dependent for tax purposes.
Okay, great. Elizabeth asks, will the current provisions in place be removed because of the lawsuits, i.e. coverage until age 26?
That is an excellent question. It seems like the coverage to the age 26 and the other protections are not going to be invalidated right now. However, some states that were party to that lawsuit in Florida are saying that they're not going to do anything more toward implementing the health care reform law. Other states also involved in the lawsuits have said that they will continue implementation until the case is resolved in the appeals court or the Supreme Court. So the actual status of health care reform implementation is somewhat up in the air for the states that were party to that lawsuit, but I don't think anybody is contemplating removing those protections. Since they are federal protections, it's not something that's up to the state to implement or to reverse. So I'm pretty sure they're going to stay in place for the time being. And it's also possible that if and when this issue comes before the Supreme Court, that they will decide that the challengers to the law were correct, that Congress did not have the power to force people to buy insurance, but they could still keep the rest of the law intact. So those protections really aren't dependent on people purchasing insurance. For the most part, they're not. So those could remain intact. Just nobody knows right now.
Okay. I have a question, actually, Janice. I know that California passed the bills to set up the exchanges, but do you have a sense of what the timing is for, implementing them after you pass the bill? I'm just wondering what the next steps are, if you happen to know.
Well, they have to be in place by January 1st of 2014, and I do not know what the next steps are exactly. I'm not familiar with the language of the California law. I believe California was the first state in the country to pass a law saying that it would implement the exchange. And I think there are a couple publications that I sent you as attachments that do address what the implementation process is going to be like, but I'm afraid I don't know exactly what the next steps are.
Okay, I was just curious.
Yeah.
Because I
assume they're going to have hearings or
yeah.
issue regulations that you can comment on.
Okay. We have another question from Monica, and again, encourage everybody to type in or raise their hand to ask questions now, because we got lots of time, which is great. Monica says, what happens if the employer says that the children have to be dependents in the income tax return to be covered under health insurance, and if they are not, add back the health expenses as income to the employee?
Is this about the adult children? I guess we can't. Well, if it's about the adult children, I believe the Department of Treasury has issued a ruling that, or a regulation saying that the benefit is not considered income to the employee. I'm not positive about that, but I'm pretty sure. In terms of minor dependents, I don't really know. I don't think the law changed anything about that.
Yes, she said, she clarified that it's adults. She's talking about adult children.
Yeah, the employer has to provide the insurance as if the person up to age 26 was a dependent under age 18 or 22 or whatever they would otherwise cover. The older dependent, or I'm saying dependent, but again, it doesn't have, the child does not have to be a dependent for tax purposes. So let's say the adult child is supposed to be treated just like any other dependent who is younger would be treated.
Okay, great. Okay, I have a question from Lori. Lori, I'm trying to unmute you. You there?
I am here.
Hi, Lori.
Hi there. Janice, I just have a question about the grandfathered plans. It was my understanding that plans that were in place when the new provisions took effect in September are not subject to the provisions until the next time the plan is, I don't know the right term, the next time the family or the individual signs up for the plan. So it's not like they're exempt from those provisions in perpetuity. It's just till the next plan term begins.
Right. A lot of the provisions, and I may have misspoken in some cases, the date of September 23rd is for new plan years beginning on or after September 23rd. So in a lot of cases, whatever the provision was that was going into effect September 23rd isn't applicable until the new plan year starts. So in many cases, that probably was January 1st. In terms of the grandfathering, a company can lose its grandfather's, or insurance plan can lose its grandfather status if it changes its policy to a large extent, and that's going to be specified in, or I think it was specified in regulations. But and for individual policies, the grandfather status is lost when you get a new plan. So I think what you're saying is generally correct. But I'm not positive about how it works, say, if you have a large group plan where the insurance carrier doesn't change, but you're just renewing a plan. I think that the plan retains its grandfather status in that case unless there are major changes in the benefits or the premiums. Does that answer the question?
It does, although that's actually pretty disturbing to me if that's the case, because that essentially could be plans exempt from these protections in perpetuity.
Yeah, it is true that some of the protections have big exemptions, but some don't, and it's very complicated to keep track. There are tables, I have one in front of me, that show what's applied to a grandfathered group plan or a grandfathered individual plan, and for all these different provisions, it's yes, no, yes, yes, no, no. It's kind of hard to keep track. If you have a question about a specific benefit, I could look at one of my tables and tell you which ones are exempting grandfathered group plans and individual plans.
No, I don't really have a specific question, but it sounds like maybe it would be interesting to get access to those tables.
I'm sorry, access to what?
To the tables you're looking at. Maybe if that's something you could provide, Tara.
Okay. Yeah, I'll do that.
Great, then we'll send those out afterwards.
Thank you.
Thank you, Lori. All right, we have a question from Elizabeth. Elizabeth, I'm trying to unmute you. Elizabeth, you there? Elizabeth? All right, you might not have the ability to speak through your computer, so why don't you go ahead and type in your question. Next question comes from Carol. If a new policy was issued to a family in December and a child in the family had a seizure in January, that the insurance company is saying it was a pre-existing condition and says it won't cover the condition though the child had no history of seizures. Can they do that? What steps could the family take?
I'm thinking.
Okay.
Well, they can't exclude, let's see, guaranteed coverage for kids applies to grandfathered group plans, including self-insured plans. So if it was a group plan, say through a large employer, then they couldn't deny any services for that pre-existing condition if they were mean enough to say it was a pre-existing condition for which they want to deny services. And if it was an individual plan, they're exempt from that pre-existing condition exclusion prohibition. They can establish open enrollment periods. But I think if they had already provided the insurance, I don't think they could deny services related to a condition that they claimed was pre-existing. I'm really not sure of the exact answer. I couldn't give an answer that's 100% certain. So I don't know if that answers the question or not. I think they're pretty safe if it's a large group plan, but if it's an individual plan, I'm not so sure.
And do you have a sense, Janice, of what a family could do if they felt like a plan was inappropriately denying them for a pre-existing condition?
Well, I think they could appeal within the plan, however the plan provides for appeals, and then they have the right to appeal to an external review body, and it's unclear to me what that is or what the procedure is. I'm afraid to say. I can try to find out more and send that along, but I don't know off the top of my head. One thing that they could do is contact the state ombudsman, if there is one, to find out about that. Some of the states that didn't already have state ombudsmen or other kinds of bodies that are supposed to help people with insurance problems were given grants to set those up under healthcare reform. Not all states took advantage of that, but some have, and I don't know I don't know what state they're talking about, but does California have an ombudsman?
I am not sure. I needed to check on that. I don't know if Lori knows, if she's still on. She's welcome to chime in.
So I'm afraid I don't know exactly.
Okay, hold
except
on.
I'd say look for state ombudsman, and I'll look for information about the external review process.
Okay. Here's Lori. Lori, you're unmuted.
Yeah, I think that's a really good question. I've always assumed that those things would go to the Department of Managed Health Care, but to be honest, I'm not sure whether they deal with denials up front or whether they deal with cases once somebody's already insured and has been denied coverage for a particular service or something. So Tara, I wonder if that's something you and I can look into, and then you can get the information out.
Yeah, that would be good.
That's a great point.
Yeah, it is a great point. Let's do that. Okay. Do we have any other questions from folks in the audience? Again, feel free to raise your hand or type in a question while we have Janice for another few moments. Okay. And If I'm not seeing any, then we might move towards wrapping up. Okay. So if folks continue to have questions that are unanswered, please feel free to email us afterwards. As Janice said, it's so complicated. Everybody's having a hard time keeping on top of it. But if you have specific questions and you haven't been able to find answers, we will work with you to find those answers. Janice, is there anything else you wanted to add today?
No, I guess people should feel free to contact Brooke and me if they have any questions. I don't know if my email is available, but we don't know, obviously, you can tell, we don't know all the answers. Some things have yet to be determined, and other things are just very complicated and hard to know off the top of one's head. But I'll try to send that information about the grandfathered plans and the external review process.
Great. That would be really helpful. And thank you so much for this. This is great.
You're welcome.
I did want to say to folks, too, that one thing that we get a lot of requests on right now from the legislator is media requests and legislators looking for stories of success, of families who are going to be positively impacted by healthcare reform. So if you know that your family or you know of a family who's going to be positively impacted or has been already by healthcare reform, know that the media is looking to highlight those stories. It's like a few times a week right now people are looking for folks. So if you have a good story, would like to talk to the media, want some help doing that, just let me know. Let me just put up my slide real quick so that you know how to reach us. Here. You can just email me and let us know because we're getting a lot of requests lately. And with that, I want to thank Janice again and Lori for chiming in. Please feel free to join us at the Health Summit again in March. We'll learn more about healthcare reform and the 1115 waiver, which is a big issue in California in terms of impacting children, youth, special healthcare needs. And keep an eye out for our next brown bag lunch. You can go to our website, sign up for a listserv, and you'll get notified of everything. And lastly, if you would please fill out a survey, which will come to you by email in the next few days about today's webinar, we would so appreciate it. And with that, thank you so much, Janice. This was such great information.
You're welcome.
And we'll be sending everybody the link in the next day or two for the webinar and all the materials we promised you. All right. Well, thank you, everybody.
Bye.
Bye.